It's been several days since the Affordable Care Act went into effect, allowing shopping for health care online in the health insurance marketplace. In the 20 states that accepted Medicaid expansion money from the federal government and set up their own health exchanges, the numbers of people seeking insurance have been significant. It's not known how many have visited the marketplace or signed up in Oklahoma. A glitch on the website has made enrollment and tracking difficult. But the system is drawing interest from Oklahomans looking for a way to get health insurance at an affordable cost.
Lynn Endries is trying to complete her application for health insurance under the Affordable Care Act, or what many refer to as Obamacare. She's accessing the federal government's online marketplace at healthcare.gov. She hasn't had health insurance for 4 years.
The jobs I have now, I'm currently underemployed, and I have 2 part-time jobs, and neither one of them offer insurance. So although I have an income coming in, it's not enough to cover individual health care.
Lynn hasn't been able to complete the online insurance application because the website keeps locking up and won't allow her to proceed. Lynn isn't surprised the website has glitches because she's been setting up on Obamacare for over a year.
When you apply, every question they ask you has to go to a different resource. So it will go to IRS to confirm your income. It will go to Homeland Security to confirm that you're okay. It will go to Social Security to confirm age. It will go to another site to confirm that you're a U.S. citizen. So people who think that it's silly that this thing is crashing, I don't think understand the complexities of what's involved in this.
We have encouraged people, if they've had problems, to go back, give the system a little time, study what the plans are before they make a decision.
Judy Grant is the Director of Community Development with the Oklahoma Primary Care Association. She thinks the online glitches are due to the large number of people trying to shop for insurance in the 36 states that did not set up their own health care exchanges.
With this whole Affordable Care Act, we have to understand that it is not perfect by any means. It's going to need to be tweaked. They base the whole plan on an assumption that all the states would accept Medicaid expansion.
The Oklahoma Primary Care Association received a federal grant to train what are called patient navigators. Diane Dunlap and Annette Willis are 2 of the more than 80 people the association has signed up to become navigators.
The phones have been ringing off the hook.
Dunlap and Willis are visiting with patients at Morton Community Health Care, which serves anyone who needs medical help. Some patients can't pay, others pay a sliding scale fee based on their income.
We have people that work every day, but they can't afford health care, but they work, they call it the working poor, and they work every day, but they can't afford health care.
Maria Bell works as a classroom aide for Tulsa Public Schools, but can't afford the premiums offered through the insurance offered by the district. How did you pay for doctor's visits?
I have to pay with my money, what I got.
That's expensive.
Yes.
Maria only makes about $16,000 a year and under the Affordable Care Act qualifies for government rebates to help reduce the cost of her premium. Navigator Annette Willis successfully helped Maria apply for insurance on healthcare.gov, but when they got to the very end of the process, the website froze. So Maria doesn't know how much insurance will cost her, but Willis believes Maria will find insurance she can afford.
And so I think when you go on the marketplace, you can get something that will fit your budget. I think it will make you feel good about yourself as an individual to know that you're getting insurance, something that you're paying for.
John Silva is the Chief Executive Officer for Morton Comprehensive Health Services. He says the Affordable Care Act will actually give the 6 clinics Morton operates in Northeast Oklahoma a financial boost and allow them to serve more people.
We've got about 21,000 registered patients. About 10,000 of those are uninsured. A number of them, we estimate maybe 30%, will be eligible. So it will be an additional revenue stream for us.
Silva recently attended the annual meeting of the Oklahoma Primary Care Association, where health insurance was a big topic. State Representative Glenn Mulready was one of the featured speakers. Last legislative session, he failed in his attempts to get lawmakers to set up an Oklahoma healthcare exchange. Silva asked Mulready why the state is not giving out any information about the federal marketplace.
And I understand that the state's not endorsing things, but basic information about what's available for Oklahoman citizens in terms of the insurance exchange should have been an automatic, and it's been exactly the opposite. Could you comment on that?
I advocated for it. I felt like it was a way for us to retain control within our state. I about got crucified for that. But at any rate, we lost that battle, and so now we have a federal exchange. I think the state's position is that is a federal exchange. They're not receiving funding to market that or educate on that. There are certain folks that are being paid to do that.
Silva believes many Oklahomans are confused about their eligibility.
State administration not only ignored it, in some ways, they kind of worked to make sure the information didn't go out. I mean, to tell the Department of Health employees that if anybody asks you a question about the insurance exchange, you go to the federal number because we're not doing anything about it.
And I'm just hoping that people will come together, realize that no matter what side of the aisle you're on, preventive care is the way to go, and it's the cost-effective way, and it's what we're going to need in our nation to get back on track with our healthcare cost, and more importantly, with patient outcomes.
Preventive care could have helped Lynn Endries avoid a $25,000 hospital bill when she couldn't afford to see a doctor and ended up with a severe case of pneumonia.
That bill I paid off $50 a month for a while until I finally took out a mortgage on the house and borrowed the money to pay them off so I could get that out of the way. So this house, which was paid for in full originally, now has a mortgage on it because I don't have health insurance.
Lynn doesn't think health care should be about politics.
First of all, this isn't a Republican or Democratic issue. Everybody's going to get sick. Everybody's aging. There are babies born premature all the time. This is a national, international issue. And something had to be done. It doesn't matter at this stage what. If this doesn't work, we need to find something else. But at least it's a step. And I'm hopeful it'll work. I'm anxious to have a little coverage.
Uninsured Oklahomans have until March 31st of next year to secure insurance and avoid a possible tax penalty.